Okay, back again, and I wanted to just talk about why I chose to do the bilateral, total knee replacements. And, a lot of surgeons don't do that at all. In my case, I'm not only having, the two knee replacements. I had previously had another procedure called the high tibial osteotomy. I have, retained hardware from that. That's a brutal surgery itself. The aim of that surgery was to push off this total knee replacement because my doctor knew that I was an active guy. As you can probably tell, I'm not small. Right now I weigh about 245 pounds. I've been a big guy, athlete for my entire life. Just from a sheer force over area engineering equation, I got non-trivial weight on the joints themselves. That high tibial osteotomy was supposed to push this out again, because, if I had done this surgery at 50 years old and then continue to ride a mountain bike or dirt bike and snowboard at 245 pounds, ultimately it's an engineering problem with the life of the device itself, the implantation device that'll be, sawed and glued and fitted into my bones and as a prosthesis. So, that pushed the surgery out. And if I was to get 10 years out of a knee replacement at age 50, I'd be doing it again at 60, and gets pretty traumatic the older you get. So I had that surgery with the intent on pushing a surgery out, and so now I'm 55 years old. So yeah, certainly I've slowed down. I've outright lost certain things, like I'm certainly not gonna run anymore, and I'm not going to at all. Start to do anything major, jumping, basketball, any of that stuff's out. And then I've given up dirt biking and all that sort of thing. So it's just, you have to be rational. What is your passion? How long you want to stay on this planet, and what kind of lifespan and health span you want to have. So so really for me, it's 3 procedures. I'm getting both knees replaced, and I also have to have the hardware from the high tibial osteotomy out at one go. So then the question becomes, can you handle it? And the surgery is, and you're gonna have to get the surgery cleared to your family doctor or general practitioner, and they're gonna take all kinds of blood work. They're gonna look at your overall health history. Is your heart strong? Is your general body habitus going to be able to handle that kind of thing? And my surgeon doesn't tend to do this either, but in my case, they decided to go ahead and do all 3 because he thinks I can handle it. Now there are risks with that they'll explain to you in no uncertain terms. I'm not really sure why this is the case, but apparently doing 2 at the same time has a higher chance of infection. Infection is one of the biggest risks with this procedure. That's the one my wife's who is a doctor herself, is quite concerned about. And then I actually have a history of that. And when I had my Achilles tendon replaced, I was at a military hospital where I ended up getting MRSA, which is a antibiotic resistant staph infection. I always said, in the case of that injury, the injury is no big deal, the surgery is no big deal. The ensuing infection that I got damn near killed me. It took them 5-6 weeks to knock out along with the rest of my gut flora and everything else. So we're going into this one with eyes wide open. And so that's a quick and dirty. In general, I want to knock it out. One big bolus of pain, one laying on my butt, dealing, less, surface area for the pain medication, over time, right? And again, my goals come out as in a couple months, and walking around, not in pain, maybe able to do a hike. Certainly I want to be back fishing, and hopefully on the bike back there before too long. So anyway, that's a little bit about my decision to do them both at once, and hopefully that was helpful for you.